Starting a family is a very big decision, and when to start one is very important. With us is Dr. Moffitt of ARMS with us to talk a little bit about when it's time, especially when you're maybe having fraternal problems, or different things like that. Let's talk about ARMS is first.
So Arizona Reproductive Medicine Specialists, or ARMS, is just a full-service infertility clinic. We help people make babies, and that's what we're about.
And we're talking about when. We know that people kind of like put it off, or people are kind of like having problems having children. So when's the best time to really come see someone like you?
Yeah, so as we've talked about before, the biggest problem we face is people coming in too late. And by too late, we mean their egg supply is getting critically low. And though we can do things, it's just a lot harder. So we'd like to try and bring people in sooner. And so that has to do with, well, what is the definition of infertility? When am I infertile? And so we basically focus on three things. Number one, are you having a period every month? Number two, your age. And number three, your duration. So as far as the first one, if you're not having a period every month, there's no reason to wait a year. Ovulation is what causes a period. And if you're not ovulating, you're not releasing an egg, no egg, no baby. So if you're not having a period once a month, come in. Usually it's very easy to diagnose, very easy to treat, no need to wait. Yeah. If you are having regular monthly periods, then we talk about age and duration. So let's talk about duration first. So we don't use the term trying, because some people we use the term at risk for pregnancy. And what that means is how long have you been sexually active, at risk for pregnancy, and not on any type of a birth control pill. Right. The reason why we do that instead of trying is because some people will say, how long have you been trying? 6 months. Well, how long have you been at risk for pregnancy? Oh, 6 years.
Wow, so it is about the age there.
It's about that duration.
Yeah.
And then the duration that matters depends on your age. And so if you are 35 or younger, if you've been at risk for pregnancy for a year or more, then you meet the definition of infertility and should come in for an evaluation.
Yeah. What plays a little bit into infertility? I mean, is it dieting? Is it exercising? Is it, of course, being on the pill or any birth control?
Yeah, so obviously if you're trying to prevent pregnancy, that's an issue. We don't think that there's a lot of diet or stress or lifestyle things that would cause a problem. It's more just has to do with the biology of what's going on, and that's why we need to do diagnostic testing. Yeah. As far as age, if you are older than 35, then the time that you should be at risk for pregnancy before coming in is if it's greater than just 6 months. Wow. Because as you are getting over the age of 35, you have less time. Yeah. And so you need to go in for a diagnosis sooner.
And this is a very important talk to have with somebody, because there are people out there who are getting frustrated about having families. They think it's him, they think it's her, but it actually just could be a combining of different things, and that's why they come to see you, so you can walk them through. And we also were talking about younger. I mean, you and I'm older than you, young man, and we know that when we were growing up, families were started younger, and now we're seeing them starting older, and that's one thing that really plays a big factor in someone having a family, right?
Exactly. So basically you're born with all the eggs you're going to have, and you go through life losing them. And so it's mainly a female issue, not so much a male issue. And after the age of 35, that fertility is going down very fast. That's why we kind of use that as a hard stop. But we also don't want to make people too stressed out. So that's why I'd like to talk a little bit about trying. What does trying mean? Yeah. The two things to remember are, number one, sperm survive for several days in the fallopian tube, but the egg only survives for 24 hours after it comes back. So when people are trying, typically what they think about is, well, we need to time sex. We need to do it at a very specific time. But the reality is, if you're having sex 2 or 3 times a week, it's going to be fine. If you can't do that, then you probably do need to time it. But timing causes a lot of stress, and so it's better to not do that, because infertility in and of itself is a very stressful thing.
Yeah, and that's why it's important to have the talk with someone like you and your team to walk them through things, and it's so important for them to do that. So where can I find out more about ARMS?
Website is arizonafertility.com, just arizonafertility.com, and all the stuff's there.
It is. Perfect. Dr. Moffitt, thanks for joining us this morning.
You're welcome.
So.